Good afternoon, and welcome to Across the Fence. I'm Keith Silva. Today, we're going to talk about seasonal affective disorder, commonly shortened to SAD. Call it what you want, winter blahs, winter blues, cabin fever. Something happens to many people when the seasons change and the cold weather sets in. Winter, especially in the Northeast, can leave many feeling down bad, feeling sad. But there are treatments to shed some light on this subject. And we brought in the expert, who is also a UVM professor. Kelly Rohan is a PhD in clinical psychology, and she's been teaching at UVM since 2005, where she is the Heinz and Rowena Ansbacher Green and Gold Professor of Psychology. Welcome, Kelly. Thank you for coming in.
Thank you.
What makes seasonal affective disorder different from regular depression?
The only thing that makes seasonal affective disorder different from garden variety depression is the seasonal pattern that it follows, where the symptoms are fully in effect during certain times of the year, and then they resolve in the opposite seasons of the year.
I heard you say seasons, so is there a summer seasonal affective disorder?
There is. It's relatively understudied and believed to be much less prevalent than the winter variety.
Mm-hmm. What are the symptoms?
The symptoms of seasonal affective disorder are exactly the same as the symptoms of clinical depression. They include feeling pervasively depressed or down for much of the day, nearly every day of the affected months, losing interest in the things that the person would usually enjoy doing, like social activities and hobbies, a significant change in energy, feeling very lethargic and tired much of the time, most of the day on the affected days, a change in appetite or weight, which could swing in either direction. In winter depression, it's most commonly an increased appetite for carbohydrate-rich foods, sugars, starches, and often gaining significant weight during the affected months.
And I'm doing some research and heard you say that naps may be a symptom as well. Late afternoon naps?
So with the sleep symptom, that's another one that could swing in either direction. People could have insomnia, difficulty falling asleep, or they could have the opposite, hypersomnia, sleeping too much. And that's usually what we see in winter depression, is sleeping a lot more than one would typically sleep, including often taking naps in the late afternoon, right around the sunset time.
So how do you know if you have depression, or seasonal affective disorder?
In my experience, it takes people a few years to put it together in terms of recognizing the pattern and then having an aha moment like, oh, it seems that my depression trickles in about the same time every year, right around the time change. The end of daylight savings time is a significant trigger for people. And then realizing also on the other end that the symptoms trickle out, that they tend to resolve, the person goes into remission at a certain time of the year.
So is it connected to hours of daylight, sunlight? There seems to be a very clear thing. Maybe the summer seasonal depression you were talking about, that's a little trickier, but is it connected to light?
With winter depression, it's definitely connected to light.
Okay.
Specifically photoperiod, which is simply day length from sunrise to sunset. Photoperiod is the most robust predictor of when the symptoms are going to begin in any given year, and also how the person's mood is on any given day. So it's more driven by day length than things like how bright the available sunlight is, temperature, wind speed, cloud cover, those other more weather-related variables.
Right. And we were talking about seasonal affective disorder happening in the warmer months. What about latitudes? Are there no people who suffer from SAD in Florida?
There are people who suffer from winter seasonal affective disorder in Sarasota, Florida, which has been specifically studied. There are far fewer people in Sarasota, Florida than in Fairbanks, Alaska, or Nashua, New Hampshire. At least in the United States, we see this really nice correlation with latitude. The further away from the equator you get, the more cases of winter depression you find, which is of course driven by photoperiod.
Right.
The shorter the winter solstice, the further away from the equator you get in the United States.
And putting this script together and researching this, There's a gender divide with SAD. More women than men experience seasonal affective disorder?
Overwhelmingly more women than men experience depression in general, including all forms of clinical depression. And then, of course, there are some subtypes of depression that uniquely affect women, like postpartum or peripartum depression, premenstrual dysphoric disorder, and seasonal affective disorder shows the same overwhelming gender difference, favoring more cases in women than in men.
Does your research show why women are more affected by depression or seasonal affective disorder than men?
I wish it did. It looks like that many factors are involved in the sex difference in depression, each contributing probably a small amount of variance to the overall effect. In my field of clinical psychology, one factor that is established to play a role is called rumination. Women are more inclined to ruminate when they feel sad, which is a kind of moody, brooding pondering about why I feel this way, how I got to be this way. Women, more so than men, show this tendency to brood when they feel depressed or down. And this seems to play some role in the gender difference in depression, as well as potentially the gender difference in seasonal depression.
From gender, let's move to age. Older folks affected more by SAD or younger folks?
In epidemiological or surveillance studies, we tend to find more cases of depression, population-wide, concentrated in, quote, younger adults in the 20s to 30s demographic. However, I've been studying seasonal affective disorder for 30 years now, and my average participant is a 45-year-old woman. So it might be true in the epidemiological surveys, but at least people volunteering to come forward for randomized clinical trials in the Rohan lab, we're seeing an older demographic.
We're talking about clinical depression here. I don't want to, it might be like, oh, it's wintertime, you get the winter blues, you get the winter blahs. This is some serious, this is a serious issue. What's your advice? Is it to treat it seriously, I assume?
Yes, absolutely. Clinical depression is a serious mental health issue. If you feel that the information you're hearing today is resonating with you, that you might have some symptoms that are predictable in certain times of year, my advice would be to not engage in self-diagnosis or self-treatment. I understand the tendency to do so, but to have a conversation with your doctor as a starting point around that. Primary care providers may have resources on site to address depression. This is happening more commonly with integrated primary care currently, where there may be resources on site to treat you, and if not, to refer to a mental health provider to try to decide, is this the right diagnosis? Do you really have clinical depression that follows the seasonal pattern? And what is the best treatment or treatments for you?
Let's talk about those treatments. What are the treatments?
There are 3 evidence-based first-line treatments for winter seasonal affective disorder. They include antidepressant medications, bright light therapy, and cognitive behavioral talk therapy. The antidepressant medications are the same ones that are used for treating clinical depression. Drugs like the SSRIs, the selective serotonergic reuptake inhibitors. Drugs that fall into this class include, for example, Prozac. And there are randomized clinical trials to show that these drugs are more effective than pill placebo for winter depression. The second treatment, bright light therapy, involves timed daily exposure to bright artificial light that simulates in intensity and wavelength the light that would be received from the sky naturally at sunrise. Light therapy can have side effects, usually mild side effects like feeling a little bit wired up, eye strain, but could include rare but serious side effects such as the possibility of dangerously elevated mood states, manic or hypomanic episodes, commonly associated with what we used to call manic depression, but now call bipolar disorder. Even in people with no prior history of manic or hypomanic episodes, it has been observed with light therapy and also with antidepressant medications. So good idea to do light therapy under the supervision of somebody familiar with these possible side effects, who can try to walk that line between getting the dose of the light therapy just right for you while minimizing any side effects.
We've got a couple minutes left, and I want to talk a little bit more about light therapy. As someone who perhaps has bought a happy light and thinks, oh, well, you know, this is good for me. It probably isn't, and you're probably not getting the same sort of care that you would get under a doctor's supervision. So please talk about, you know, just don't buy a happy light and think you're all set.
Just because one can walk into Costco and walk out with a happy light does not mean that one should. Even though light therapy is a cottage industry, not FDA regulated, I do view them as medical devices and strongly recommend that people pursue it under the supervision of someone who can help get that dose just right. How many minutes a day do you need to use it, and what time or times of day do you need to use it while minimizing any side effects?
And what about just old-fashioned sunshine, just going outside if you're a skier, snowshoer, going on walks during the winter around the neighborhood, anything like that? Is that sort of light therapy as well?
So my advice for pretty much anyone, whether you have seasonal affective disorder or not, or you just have maybe the winter blues, take advantage of the light that is available. Take advantage of beautiful Vermont.
Absolutely.
Try, if possible, to get out for 30 minutes, ideally first thing upon waking after sunrise, but any time is good. Engage in skiing, ice skating, snowshoeing, snowboarding, whatever winter sports that you like.
Well, Kelly, thank you very much. I've heard you talk before, and we've been a guest on our program before, and it's always fascinating to hear an expert like yourself talk about this seasonal affective disorder. We hope we've helped you feel a little less sad and a little more happy. I want to thank the crew here at WCX who always makes me happy and our program possible. I'm Keith Silva. This is Across the Fence. Have a good one.